The following segment is sponsored by Stubbs Dental. Dental anxiety is a real thing when you sit down in the chair and all of a sudden you feel your heart just start racing. Well, that doesn't have to be that way. I'm here with Dr. David Stubbs from Stubbs Dental. Thank you so much for being here.
Thanks for having me.
Okay, this is a real thing that I think that kids experience it and even adults experience it, and it's dental anxiety.
Yes, it happens from little kids all the way up to adulthood. You know, usually because of a bad experience they happen when they were a kid. But I get patients that had a bad experience last year and they come to us and they said, you know, I am so grateful you guys offering, sedation, because now I don't have to worry about that. So they come to us from a different office or something like that, and we're able to help them out.
Well, those things, I know it sounds dramatic, but I had a bad experience when I was a kid, and it can scar you for life. And then I've stopped going to the dentist. You start avoiding things, and then you end up having health issues.
Yeah. So we get a lot of people that come in, haven't been to the dentist for a long time because of that anxiety. So they put off things that they could have prevented. So things get a lot worse over time if we don't prevent it.
Well, and the good news is that there's all levels of sedation. Walk us through the process.
Yeah, so there's a really light sedation like laughing gas, like people have heard that, nitrous sedation, where people are fully awake, they remember everything. Then there's a pill form, which we don't like to use. A lot of dentists do use this, but we don't like to use it because it's not very predictable. I mean, some people will get really asleep and really groggy. Some people won't get any effect. So we like to use something called an IV moderate or deep sedation. That's the one we use the most for shorter procedures. And we do something, as you know, called the all-in-4, where we replace the teeth in a day, or we give them teeth where they haven't had teeth in a day. And in a lot of those cases, we use general anesthesia. So we have an outside provider come into our office, and they're in a very deep sedation in that situation.
Let's talk a little bit about the all-in-4, because what you're doing here is you're transforming smiles, and we've got some before and afters here, because these people, there's the glow on their face. Like, you've completely changed their game with this. So how does the all-in-4 work?
So the all-in-4 works, and I appreciate you say the glow thing, because honestly, people they come on Dave's surgery and they're super excited after they get their smile, but it's 3 months later, they've had 20, 30, 40 compliments on their smile, and it's just a difference about them. But just to go into the details of how that works, they're asleep for that whole day.
So no pain.
No pain, no remembrance of everything. When they come to, their teeth are already in or getting put in, and they're completely numb. But you either take the teeth out if they have teeth, the bad teeth out. We clean everything out. There's a lot of infection that's typically there when these patients come to us, and we place new implants, and we screw on a set of teeth, and it's all fixed. It's all on the day of. There's no denture, or they don't leave with something that's removable in their mouth. It's typically always that fixed teeth all on the same day.
Imagine that, just waking up and you've got the smile of your dreams. And I got to ask, can it pass the apple test, when you bite in?
So this is what I always tell patients. Since implants take they take about 4 to 6 months to heal. We do have them go into a soft food diet. 6 months later, though, we make them a strong porcelain zirconia bridge, and they're chewing corn on the cob, apples, they're chewing carrots. I'm talking about raw carrots and salads, things that we take for granted all the time. And that's the cool part, is seeing that, they get the smile the same day, but they get all that function once those implants are healed. They can do everything they haven't been able to do for a long time.
A full transformation. Really quick, you've got a special offer for us.
We do. So we always offer a complimentary consultation. So we'll give a CT scan. We'll take a 3D image of their jaw bones, make sure they're a candidate for this, which most cases they are. Even if they've been told that they're not a candidate, please come see us for a second opinion. Most patients are a candidate for this. And then we do also offer 20% off of the all-in-4 procedure, which is great.
Incredible. So call the number on your screen right now and get that smile transformation. Thank you so much, Dr. Stubbs.
Thanks for having me.